Okay. Hello everyone, this is Dr. Mansi from Homeopathy 360. A very warm welcome to all of you with the our next series, that is podcast series on Beyond Boundaries with Homeopathy 360, named Tips and Tricks to Crack AIAPGT. Today we have very brilliant doctors like Dr. Sujeet Lal sir and Dr. Ranjita ma'am. A very warm welcome to you, both of you.
Thank you, ma'am. Thank you so much.
Thank you so much, ma'am.
So let's have a brief introduction of both our brilliant doctors. First, let's have Dr. Sujeet Lal sir. He is BHMS from National Institute of Homeopathy, Government of India. MD Homeopathy Materia Medica from DNT Homeopathy Medical College and Hospital from Government of West Bengal. Presently, he is working as Associate Professor and HOD Department of Surgery from Padul University of Homeopathy and Research in Vadodara. He also runs a PGT preparatory class named Homeopath Way as co-founder for undergraduate students since 2 years. He has also published articles in various national and international journals. Very congratulations to you, sir.
Thank you so much, ma'am, and thank you for inviting us. Thank you.
It's our pleasure, sir. Now let's introduce our another brilliant doctor, that is Dr. Ranjita Gupta. She's BHMS from again National Institute of Homeopathy, Government of India, and MD Homeopathy, Organ of Medicine, DND Homeopathy Medical College, and Homeopathy, Government of West Bengal also. Currently, she is Assistant Professor, Department of Community Medicine, Padul University of Homeopathy and Research from Vadodara only, and runs APG preparatory class named Homeopath Way as co-founder for undergraduate students since 2 years. She has also published various articles in national and international journals. So, ma'am and sir, we both are very proud of you. And
Thank you, ma'am. Thank you so much for inviting us. And we thank Homeopathy 360 also for inviting us for this podcast.
Thank you so much. Thank you, ma'am.
it's our pleasure only, sir, because you both are doing already for the undergraduate students. You are all already educating them. It's very good to hear that you both are so dedicated and passionate about teaching. And
Definitely.
we are
Yes. We had our coaching running from the last 2 years. This year also we have students from Vadodara, offline and online also we have students. We provide test papers and everything. We both run together under the banner of Homeopathy. So thank you so much, ma'am.
thank you, sir. Thank you, sir. And today, again, we are going to learn from both of you. Like as you both have cracked a PGT for NIH, and we all know, coming to getting admission in this college, it's a dream for many homeopaths.
Yes, ma'am. You are true. Like cracking this exam, it's like for everyone who will be preparing, it's for them, it's a dream.
Yes, ma'am. So, ma'am, it will be. We are very happy to learn from your experience, your tips and tricks. So, ma'am,
Definitely.
begin.
Sure.
Okay.
Okay, ma'am. So the very first question to all the speakers, that is, how was your experience when you saw your result, and how did you feel on that day, on the result day?
Sharing my experience, ma'am. When the AIPGT started in the year 2017, so that was the first time when it was AIPGT. So
Yes.
it is the first batch of AIPGT we
Okay.
both are there from. So AIPGT as a whole, it was very new to us because initially we had started preparing for individual state exams, PG exams, which were occurring previously. So as we are from West Bengal NH College, so we started preparing for West Bengal entrance examinations. But in the meantime, it was announced that there will be an all India level examination. So the first announcement itself was quite new to us, that
Yes.
we'll be competing at a all India level, not at a
Mm,
state level. So that was scary. But yes, the determination was there that we need to do MD. So that is very, very important. And seeing the scorecard, I will say now the AIPGT has become quite advanced. But back in 2017, when we were the students, um, we did not had a rank list or something sort of at that point of time. We only had our individual marks or individual scorecards. So we just
uh,
so we just came to know about the marks we scored out of 100. At that point of time, it was only 100. Now it is 120 questions,
mm,
480 marks. But that time it was only 100 questions, 1 marks for each question. So it was only 100 marks, 100 question. So we only got to know about the marks, what is the status, what is the rank, and everything. It was
mm,
very.
It was announced later that what was our rank
Yeah,
list.
and that was also announced at a very later stage, even much later, that we got admissions to our college, and then the rank list was published that yes, this is the All India rank list. So it was
Like,
quite
yes,
interesting also, but
uh,
okay.
so,
But nowadays, so times have changed because we have been teaching to our students, and they are there. So um, everything on the day of result, they come to know that they have
mm,
scored so good. What is their status? What is their rank? So
mm.
APGT as a whole from 2017 till 2024 has advanced a lot.
Yes, yes, definitely. So we have seen many changes in the question paper style plus the counseling pattern. It is changed
yes,
a lot. So, sir, are like as in your introduction, we have seen that you educate the other students. So, sir, was the what was the preparatory pattern of your preparation uh, during your time? Like, have you taken any coaching or did you clear by yourself? What was the
Ma'am, yes, definitely. We have both taken coaching in West Bengal, Calcutta itself.
okay?
I would say coaching is quite helpful and beneficial because they'll guide you. They will provide you a path because they have been doing it from a number of years. So
Hmm.
they have ready reference material, what are the changes which has been occurring in the previous years, what are
Hmm.
the areas you need to look into, and where you have to just skip. So these are the help which we get through our coaching classes or coaching individuals. So that I would suggest ki yes, if anyone is opting or thinking of for preparing, not just
Hmm.
preparing, for cracking AIPGT, and cracking good as if to get into a government institute or an institute of repute. So
Jim,
coaching centers,
yes,
yes, I would definitely suggest. Even one new thing which I have noticed, that even in the registration process for the AIPGT, the form fill-ups which they are taking, they have started asking a question that whether you are attached with some coaching institutions or not. Because when we were registering for the AIPGT examination, there was no such question which asked us that whether you are taking a coaching or not. But now the center is also asking that whether you are involved with some coaching or you are doing self study. So they get a good idea about the number of students who are actually preparing for the entrance, and so they get a data also that yes, out of the 15-20,000 students, there are around say 60-70% students or 50% students who are actually preparing. So you get a very good idea from this.
Okay, so I think there is only the purpose of asking this question is only for the data, I guess, not for any kind of
Yeah,
friends.
that is basically for the data only.
Okay, okay. So that doubt is also cleared. Sometimes, students while
Yeah.
at form they got a thought that why they are asking.
Yes, and many times what students do, they opt one coaching centers, but from different coaching centers, they take this mock test and all. So it becomes difficult for them to choose which coaching center they can name. So it's like a data, just data
Hmm.
only.
Okay, okay, okay. Okay, sir. Let's move on.
Yes, ma'am.
Uh, so, ma'am, would you like to share your recommendations or suggestions for the books like that you have used during your preparation?
Yes, definitely, ma'am. That once any student, if they are deciding that they will do MD or they will crack this exam, the most important book they should have is the Success. And till date, from right from when we prepare till date, Success, it is giving the best information, right? All homeopathic subjects are covered under this books. Everyone should have all the volumes of Success. Apart from that, Crack the Entrance is a very good book from where they can study Mathematica. They can get their so many things, previous year's questions also, relationship also, so many things they can get from that book. Apart from that, for homeopathic subjects, I would like to suggest Kaizen also, very good book. Apart from that, if one wants to do something more, they can go for Turning Point also. So these are the books students should have for preparing homeopathic subjects, right? And when we come to the allied, that they can refer Rome's, they can refer Mudit Khanna for medicine, and for like if someone is preparing Mudit Khanna very nicely, I will say out of, if the question, suppose if there is 10 question, out of 10 they will at least score 8 questions correct. So that they
Oh,
can do for medicine. Mudit Khanna is good, Rome's is good, and if they want to go subject wise, right, they can go for PSM and FMT, community medicine and FMT. They can go for this sub series. If not, they
hmm,
can for this subjects they can go for Rome's also if they don't want to take these books. But we have studied from this book, so I am suggesting, right? And apart from this, if you want to study some more like community medicine, they can think of reading Vivek Jain also, right? And for gynae ops, Rome's is there, right? And plus Sakshi Arora is another book which they can refer. And for other subjects like pathology, anatomy, physiology, Rome's is sufficient, so they can refer from these books.
okay, ma'am. Okay. Thank you so much for your suggestions. And so, plus, ma'am, sometimes students also go for the uh, preparatory manual that the coaching institutes also provide. So, should the students also take them for their preparation?
Definitely, ma'am. Definitely, they should take. They should consider this also. What we have done during our time, that whatever materials our coaching center have provided, what we have done, we have made a collage, like whatever we have studied from that material and whatever we have studied in the books. So what we do, we normally collaborate it. We just add it. We add whatever information we can get. So what help the coaching center gives is that they will fix the areas, right? They will fix the areas from where the questions are coming more. So that is the importance of giving the manuals or giving the materials from the coaching center. That you will know the area from where the questions are coming, and so you can refer that area from the book. So that they can do.
Okay. Okay, ma'am. Thank you. Um, Plus, ma'am, can you clear the doubt of the students that many times, uh, like when the students is the beginner for the preparation of APGT, they opt for their main books, that is our educational books. Like their subject wise that
Yes.
you have to read in their UG.
Okay.
So it's
So,
important to
so
get through
this
all those books again.
this is what makes different when you are studying in BHMS and when you are going to study for your MD entrance. So for MD entrance,
Hmm.
should be clear that you don't have to study everything. I mean to say, it is not possible to study the
Okay.
4.5 years course in a 1 year, I will say, if they are taking 1 year for the preparation. So what they
Hmm.
don't, what we have done, it is my view that we normally go to the books, the preparatory books or the material we get from the coaching center. Because if you go
Hmm.
see this, all the textbooks and all, it is time consuming. So the
Hmm.
students must understand the preparation, what they have studied or what they have studied during the BHMS. It is different
Hmm.
what they are going to study for the MD entrance. That is totally different. So that they have
Okay.
to make
Okay.
sure that if they'll study from the textbook, it is time consuming and they will not get an idea of area from where question is to come.
Okay.
So
Okay. Thank you,
this
ma'am.
difference they can make. Okay.
Okay. Okay. All right. Okay. Sir, would you like to share how did you divide your time between theory and MCQ practice?
Yes, definitely, ma'am. We even had our own strategies which we used during our preparations. Plus, also we even help our students also. We are who are under us teaching in our coaching classes. That division of time is very very important when we are talking of theory or when we are trying to solve questions, MCQs. First of all, the first and the foremost thing is that. Uh, one of the biggest tasks is to complete the syllabus, right? Complete the syllabus or cover the portion or cover all the 12 subjects which we have studied in BHMS. As ma'am rightly said that we cannot study everything what we have studied for the 4.5 years, 5 years. So we need to come to a closer area or a closer circle from where we need to get things. So for that we are having preparatory books, preparatory manuals, and notes from the coaching centers. They are giving us the areas. The biggest task is to complete that theory portion once, because
Yes.
if we finish that theory portion once, the
Huh.
time taken for the revision shortens.
Huh.
Suppose for the subject of medicine, practice of medicine and materia medica are the two subjects which has the highest number of questions
Hmm.
every year.
Hmm.
If you go to the question number distribution also, from last AIPGT onwards, they have given a blueprint that
Hmm.
from certain subjects these many questions are going to come. Previously the ratio, previously before 2024, the ratio was that around 45% questions were from homeopathy
Hmm.
subjects and the rest was from allied subjects. From the last year, in the year 2024, there was a notification which said that it will be probably 50-50, and it was 50-50, it was close to 50-50.
Because last year, one out of 120 question, 58 question was from the homeopathic subjects. So it was
Okay.
50-50 almost.
So it was closely 50-50. So now I need to focus on my theory. I have completed studying theory once. So how to cover everything in a very short span of time is that, see, that totally depends. Getting to theory and solving MCQs is on individuals' intellect and individuals' timeline. There are students who are very good and energetic during daytime.
Huh.
Their brain works the best during daytime, and there are students who work at their maximum capacity during nighttime.
Yes. Yes.
So as far as we are concerned, the intellect of the student is very very important, and their reading pattern is very important. So when you are fresh, when your mind is at the optimum level, when it is working good, go for theory, study theory. And for study also, you have to plan and devise the amount of hours you are going to give, the amount of days you are going to give. So for that you can make a timetable, you can schedule your timetable, and try and give almost all the subjects in 1 week schedule. Suppose you are studying theory portion during the daytime, you can solve the MCQs during night time, or
Mm.
vice versa. If your brain is working good at night, go for theory at the night time and solve the MCQs, related MCQs or overall MCQs or previous year questions during daytime. So when
Okay.
brain is functioning maximum, go for theory. But when you are feeling sleepy or dizzy or drowsy, you feel like taking a break from reading theory from so many hours, go for MCQ. So in that way, you will
Okay.
break down your fag also, and you will extend your study hours also. So it will help you achieve daily routine target, say about 10 hours, 12 hours, 14 hours. So that is
Mm.
also very, very essential. Studying 12 to 14 hours a day, if you want to get a very reputed college and get a good rank, so that amount of time, it is definitely required. The AIPGT preparation is like every other preparation which occurs in the preparatory world, be it UPSC, be it
Great.
NEET UG, NEET PG. So it is
Mm.
equivalent. The amount of time is required.
Okay, sir. Thanks, sir. Thank you. So, sir, while preparing for the APGT, many students make their notes themselves. Like they do not prefer the UG times notes. They make their separate notes. Like, so how important is note making, and what's your style of doing it?
Ma'am, definitely it will be different from undergraduate, because see, when we are in UG, our aim in undergraduate is to pass the examination. When we are
Okay.
studying in undergraduates, at that point of time our aim was to pass the examination. First and
Huh.
foremost thing, first I should clear my first BHMS, I should clear my second BHMS. So at that point of time, student mainly focuses on the areas which are exam oriented, the questions which are repeatedly coming in the university examinations and such. So they prepare notes accordingly, but we cannot rely totally on those notes which we have prepared in our undergraduates. But definitely UG knowledge should be there. A person who has a sound undergraduate knowledge tends to perform good during the preparation or during the AIPGT. But it does not mean that a student who was very good, very brilliant, and a average student or a below average student who passed his or her BHMS with difficulty or with supplementaries, he or she is not capable of clearing AIPGT or getting a good rank, because we ourselves have so many friends and batchmates of both the cadres, who were very good students or who were average students, very good students not clearing the exams, average
Uh,
students clearing the exams with very good grades and results. So that is very different. So yes, preparing notes. I guess ma'am will share few more things on preparing notes.
yes, ma'am. Please share.
So preparing notes for the MD entrance, like if someone is deciding that yes, he or she will be doing this. So first thing what they can do is that analyze the question paper pattern, right? They can analyze the question paper pattern. Previous year's questions are very important in this, that you have to go and see the previous year's questions, from where the area questions they are asking, and what is the number, the marks they are allocating for that papers, right, or the for that subjects. That is also important. So we can discuss this subject wise also, right? We can go with, first we can go with the homeopathic subjects. So for homeopathic subjects, I will say that if you see the pattern of questions, right? If we see the pattern of previous year's question, there are like, this is the place where you cannot skip anything. Like you have to study everything from homeopathic subjects, and that is also, it depends on individuality. Yes, whether you are able to understand the area from where the questions are coming or not. So it's not like that ki whatever you have studied in UG, that will,
Mm.
everything is included that in this, like I will say, in this topic or in this area. That we have to understand ki the area from where the questions are coming. So if we see, just I said ki out of last year only 120 questions, 58 questions were from the homeopathic subjects, and out of that 58 questions, 50 questions was from not pharmacy, it was from organal, materia, and repertory. So 50 question was from organal, materia, repertory. So we can analyze the weightage of the subject. Okay, that students what they can do. After analyzing the weightage, what they can do is they can analyze the area also from where they are asking the questions, right? If we go subject wise, I will say for organal, aphorism is must, right?
Oh,
They must know all the aphorisms. That is a very important area, what they are giving, from where they are giving questions, right? That is important. Another thing, from where philosophy is important, Kent philosophy, that is important, from where the questions are coming. These are the areas, fixed areas from where the questions are coming. So if, yes, almost every year the questions are coming from this area. If some students, they are not having time, if suppose they don't have a time to revise everything, so at the end time I will suggest don't skip this area for revision, right? If we go to the this one, repertory, rubric hunting. Nowadays rubric hunting, there are so many questions from rubric hunting. So one should must see rubric hunting. They should be like doing this rubric hunting again and again, again and again, practicing, because rubric hunting is something where you cannot use common sense, right?
mm.
That
Yes, you
is
have.
important. Yes, that is important. You have to practice or you have to study. You have to mug up that from where this is, from where that is. That is important, and which is coming again and again these days. Like if you see from 2019 to 2024, this rubric huntings, the weightage of rubric hunting is so much. Apart from that, in repertory, Kent repertory, they cannot skip, right? They have so many topics coming from Kent repertory. They have
Mm.
BGBP from and BBCR. Short repertories they can go, but these are the things from every year they are getting the question. If we talk about another subjects like pharmacy, if we talk about pharmacy, acts are coming which don't used to come previously. If I talk about previous year's question, around 2018, 17, like that, in that area, acts was not so important. But nowadays, yes, act is important from pharmacy. I guess every year question is coming from the pharmacy. So like this, they can analyze for topic or for the important things, what they can do, what students can do.
Okay, ma'am. Thank you so much, ma'am. And as you have discussed the acts from the pharmacy, we remember there are definitely one question from the acts, and
Yes,
plus we have years and acts to be learned in the forensic also.
yes,
Plus, if we talk about the years, we have PSM also.
yes,
Have to learn programs. We have lot of programs.
yes. Programs and like forensic, as you mentioned. For
Mm.
forensics, one tips I want to give to all the students who is going to appear, don't leave toxicology. Because toxicology right now from previous years, from if we see the previous year's question, toxicology is the most important
Okay.
area of question, because last year only I guess six question was there from FMT, and out of six question five was from the toxicology.
Yes, yes, ma'am.
So
Yes, ma'am.
don't leave toxicology. You cannot skip toxicology and FMT. This community medicine are the subjects where you cannot afford to make mistakes, or where you cannot afford to make wrong. You cannot, if you do wrong, you have to score whatever is the total marks. You have to score it, because if you make wrong, what happens? Your rank will drop down. So this is the subjects where you can. score good, because FMT it's hardly 700 to 800 MCQs. If I talk about the number of MCQ, you can finish FMT around in 800 MCQs, right? So what they can do is that they can go this subject very nicely. Same goes to community medicine. What things is coming in community medicine is the, as you mentioned, ma'am, that is the national health programs. And what they are asking is the recent addition. So
Yes.
recent addition they are asking in the previous year's question. So these all are the area what students can focus like, and it will come only by analyzing previous year's questions only.
Yes, ma'am. Yes, ma'am. Definitely. So, ma'am, as we are discussing the topics, would you like to recommend some topics that one should not skip in the subjects like medicine? Although
Yes.
medicine is a very wide subject, it has categories.
Yes, yes, definitely, ma'am. For medicines, I will suggest, right, like nervous system, they cannot skip from, if you see the previous year's question pattern from 2019, every year there is one question from nervous system,
Okay.
musculoskeletal system, that is also
Hmm.
important,
All right.
urinary system, that is also important, right?
Hmm.
And if we see the questions, I guess last year there were no question from CVS, so this time they have a chance to get a question from CVS, so they cannot skip CVS also.
Yes.
And respiratory was also another system. I guess last year there were no question from respiratory system. So what they can expect that this year they might get question from that section. So I will suggest nervous system, musculoskeletal system, urinary system, and yes, CVS I said, and respiratory system. These are the system. Don't skip it. And hematology, yes, blood is also another one where like they cannot skip.
And I'd also like to add one specific dermatology from the year 2017 till 2024. It has been asked only twice. The first in the year 2017, half the medicine was full of
Full of
dermatology.
dermatology.
Out of 17 18 questions, close to 6 to 7 questions were from dermatology. And after 2017, after a gap of 2 to 3 years, questions were asked from dermatology. But after that, dermatology has been not asked from the last 2 to 3 years. So
Hmm.
there is a possibility
Possibility,
that
yes.
they might get questions from dermatology. And
Uh,
if you have by any chance not touched dermatology till now, you can just go through two or three topics, that is psoriasis, lichen planus, and
Dermatology.
dermatitis. These are
Eczema.
the eczema and
Yeah.
dermatitis. These are the areas, especially psoriasis and lichen planus. So these are the two conditions from where the questions are very likely to come if they do come from dermatology.
okay, sir. Thank you so much, sir, for sharing such
And
important.
one more topic I would like to suggest, a specific topic from medicine, like the students must study for this year is diabetes. I
Oh,
guess if we talk about diabetes, 2001 there were question, 2022 there was a question from diabetes mellitus. 2023 there was a question, in 24 there were no questions. So there is a possibility maybe in 2025 question can be from diabetes mellitus. So study diabetes mellitus properly.
okay, ma'am. Thank you so much. So, sir, we can say that in the when we have such short duration of preparation, like exam is coming, so I guess attempting more questions than the theory, that will be more beneficial in the last few months.
Uh, uh, so, ma'am, if it is from my point of view, if I am in the last month of my preparation, only
Mm.
15 20 days or 1 month is left to appear for the exam. At that point of time, I will focus mainly on theory. I will not focus on MCQs, because the MCQ knowledge or MCQ memory may lapse. But
Okay.
whatever you are reading in your theories, or whatever you have read by the last 6 to 8 months or 1 year, you should only focus on those things. And even if by any means you are solving previous year questions or solving MCQs, and you are not able to answer questions, and you are thinking that from these areas I am not able to answer any question, it's okay, you can skip that. You need to focus on those areas which you have already completed. So if I am in my last month or last 15 days of preparation, I'll focus more on the theory rather than going for MCQs. Because if I practice more of the theory, if I revise theory as many times as possible, consistent revision of theory is very very important at the end moment. Because when you will solve the question at your examination center, you will remember your theory, you will remember your theory notes, you will remember something written at that page, at that corner. That photographic memory of your theory notes will be there, but the memory of your MCQ will not be there. The MCQ memory is very short. So
Okay.
as far as we are concerned, during the last moment revisions,
Huh?
go for theory,
Theory.
and only that much which you have studied till now. Do not go for extra.
Okay, okay. Yes, sir, that's true. Even we can say that MCQs cannot replace the theory part. Like if we are going to learn, then theory will help us.
Yes. If you're coming across some MCQs, and you suppose you have read a few topics and you have come across some
Mm.
MCQs which you were not read in your theory.
Hmm.
So suppose I'm taking an example of cardiovascular system.
Hmm.
Uh, Myocardial infarction, I have read nicely. I have solved MCQs also. But solving some very old papers, you came across some few myocardial infarction questions which you have not read in your theory. So incorporate that MCQ knowledge
Knowledge.
which you had in your theory.
Oh, okay.
So
Yes.
when you will revise at your end moment, you will have two more points to remember. And when that question comes, you will remember your theory, that yes, I have read it in my theory, and you will be able to answer correctly. But if you have read that particular information in MCQ only once, high probability is you will forget that.
Yes, sir, that's true because in the MCQ part, we have four questions, four MCQs already. We have four options, so we might get confused while remembering that question.
Yes, ma'am, definitely.
Okay, sir. Moving on. So, sir, what role do previous year papers and mock tests play in the preparation?
Previous years, ma'am, as ma'am has already said in our previous discussions, the role of previous years papers is very much important in terms of analysis.
Oh,
Uh, Ma'am has already given us a detailed analysis that how helpful are the previous years papers. It not only helps you in analyzing that from what areas you are going to get questions, but it will also help you what not to study, or
okay.
what you can skip,
Huh.
or what are the areas of less importance. So that is very very important, because you cannot study each and everything, you cannot cover every topic, you cannot cover every question.
Mm.
So it's something like that. For an example, hematology, multiple myeloma, they ask questions almost very frequently. So if I have to suggest that something very rare, which is very fascinating and question comes very repeatedly, read
Huh.
multiple myeloma once. Do not forget multiple myeloma, because there is a probability out of 3 times, 2 times you will get a question if a question comes from hematology. So these are the areas which will help us, and the previous year question papers help us in this very particular fashion. The areas, the topics which we can study or which we can skip. And
Okay.
and there is also probability that you may get a question from previous year paper not directly, but
indirectly.
indirectly.
Yes, yes, yes. And would you like to share the importance of mock test that we attempt for in our preparation?
Yes, ma'am. Mock test is very important for each and every student who are preparing. What mock test it play role is that, like, it makes you it gives you a visual, what should I say, that it makes you more better, I will say that it makes you perfect, right?
Okay.
So you are preparing from last 8 to 9 months, or you're preparing from 1 year. Someone, there are many students who used to prepare for 2 years also, right? In first time they don't crack, they try for next year. So this is also there. So what they can do, what mock test usually what it provide is that it makes you perfect day by day, day by day.
Mm-hmm.
So try to give as much as mock test you can give, what I will suggest, right? And mock test will help you to reduce your negative marking also, I will say, right? How? Because whenever we appear a mock test, or whenever we give some test, right? We what the area we usually make mistakes. The area we usually make mistake is the area, especially take it example, if there is some question of match the column, right? That is a place where students make mistakes. We know the answer, exactly, we know the correct answer also, but when we are going to mark, when we are going to tick, we know what we do, we used to give the answer on the wrong part, wrong option. We know the right answer, still we forget, because of some anxiety, I will say, or some reason, we tend to mark on the wrong answer. So what mock tests do, it makes you better. It gives you, okay, I'm making mistakes out here, I have to be careful. Okay, if you are making mistakes matching the column, what they can do, they are provided with the paper during examination, they will get one rough paper. What they can do, they can match that column in the rough paper, and they can go for that right answer. And practice also, if they makes more, practice makes man's better. So this is like mock test is like a practice only.
Okay, that means they provide us a self realization.
Yes, exactly.
Okay. Okay. And ma'am, would you like to suggest that what common mistakes aspirants make during the actual day of exam? Would you like to suggest that those mistakes should not one do on the actual day of exam?
Okay, ma'am. So first thing I will, what I would like to share is that when you are in examination center,
Mm-hmm.
don't be nervous, be
Mm-hmm.
calm. Don't be nervous,
Okay.
because you enter your center 1 hour early only, right?
Mm.
So just utilize that 1 hour. Don't be anxious, stay calm, right? And if yes, another thing I would like to even inform to the students, those who are watching this podcast, if some technical glitch happens on that day, suppose at the middle of the exam your PC like suddenly it shut down, right? Yeah,
Mm.
there is some technical error, something happens, don't panic at that situation, because the same condition had happened to me, that's why I am sharing this. Because
Okay.
at the middle of the exam something happened, my PC it was not working. So what happens, the time where it has stopped, whenever you start your exam again, it will start from that time only, so no need to panic if there is
Oh,
some certain condition in the time, during the time of the exam. So don't panic. This I
okay.
would like to highlight. Next, I would like to highlight what students, like what mistakes we do is the reading the question properly. Like,
Huh.
read the question properly. What we used to do, we tend to forget to read except, not, if there is some
Mm.
question, all are the features except, we forget to
Mm.
read except. And what we see, if we are coming out of the center, and we are, when we are discussing, and suddenly I realize, ja मैंने तो वो except पढ़ा ही नहीं, right?
Yeah.
So that is the mistakes what students do. Not, these all are the things what they can avoid, they have to avoid, or they make mistakes during that time. Another
Yes.
thing I would like to highlight is what I said only, marking the wrong answer. Don't mark wrong answer. Make sure you are marking the right answer only. So these are the things, like these are the mistakes which usually students do during that time period.
Okay. And sir, would you like to share some tips on avoiding the negative marking? Like sometimes we think like we know the answer, and sometimes it's like we should not attempt that question. So, how to choose between the do or do not?
uh, to choose between do or do not is that whenever we are attempting a question paper,
Hmm.
whatever we are attempting at the first go, in the first 1.5 hours, 60
Hmm.
questions, 65 questions, 70 questions, probably those questions are with surety or are under some of our knowledge we have attempted. And post that, uh, after 1.5 hours, I came to know that I have attempted 65 questions. I need to increase my number. I need to increase my attempt count. And in that attempt, I tend to give guessworks and give few more questions. I should attempt my increase
Increase.
my attempt, so that there may be chances that I may increase the marks, but that is not the case scenario. Most of the times, uh, a student should never attempt a question which he or she has not even seen or read once. The first and the foremost thing, उसको छोड़ ही देना चाहिए. The second
Hmm.
thing, suppose there is a question and the question has four options, as we all know, and out of the four options, uh, I know two options. In my knowledge, I have read or I have some information about the two options, and the remaining two options are out of my
Hmm.
knowledge. So
Yes.
in that particular case, I need to take a risk. I need to take a little bit of risk and attempt that question. But suppose I know only a single option out of all the four, and three I don't know. So probability is I will mark
Wrong answer.
wrong answer rather than giving a right answer. So skip those questions. So in this way, we can avoid negative markings. And as ma'am has already mentioned, one of the areas where we tend to get negative markings is we are reading questions in a hurried manner. We are forgetting notes and we are forgetting accepts, and we get to know just by reading two or three words in the question paper, we get excited. Yes, I
Yeah.
know this question.
We
That
Hmm.
that excitement is always there, because whenever we get a question from our known area, we are very excited to answer that without even looking at the options or reading the other options. I saw the question, aim of the physician. I marked aphorism number one, and later when I discussed question with my friends, the question was sole aim of the physician, and the correct answer is aphorism number 17. So I knew the question, I knew the answer, but because
But
of
we did
excitement, yes,
that.
because of excitement, I
made a mistake.
made a mistake. So that excitement
Hmm.
also can lead to a negative marking. So
Yeah.
if we know the question, even if I know the question, I'll just give some time to that question, read it thoroughly, and then answer. So in
Okay.
these ways we can avoid a number of negative markings. Yes, but yes, we also do need to attempt as many questions as possible.
Okay. So, sir, can you give a roughly idea of the percentage? Like we can take chance on the risk for this percentage of question. Like from 50 questions, how many questions we can attempt on the risk?
Uh, Ma'am, see, any student who is preparing homeopathic questions should be attempted
Full
at the
question.
maximum. Suppose 58 to 60 questions are coming from homeopathy. So our preparation should be such that I do not skip a homeopathy question, because
Oh,
skipping homeopathy question will lower your rank, lower your grade, and your chances of getting a good college. Because homeopathic subjects, there are only four subjects, and
uh,
out of those four subjects, pharmacy, organon of medicine, as ma'am mentioned, there are
Mm.
areas from where questions are definitely going to come and we are going to score. So if we skip those or we miss those, so our marks are definitely going to decrease. So pharmacy 7 to 8 questions are going to come, and there are only 400 to 500 MCQs in pharmacies. And if
Mm.
I skip a question from pharmacy, I have attempted only 2 and 3. So
Mm.
definitely my score will going to come down, because there are other students who are sitting, they have attempted all the 8 pharmacy questions and I have attempted only 3. So my mark will definitely go down. That is one area. Then
It's not the way, ma'am. They can like do taking a risk. We will say that out of 50 question, if they want to take a risk of attending the question, take a risk. As for me, I will suggest take a risk if you know something regarding that question. If you
Okay.
don't know the question, don't take a risk. I cannot suggest how much of risk they can take, right?
Mm.
Like how much of question they can keep it under risk. But I will
Mm.
just suggest that if you know the question, then take a risk of putting the answer. But if you don't know anything regarding that question, don't give a
Do not.
risk. But if
Yeah.
the person, if out of 120 question, if the students are attempting 80 question, go for 10 more. Take a risk. Go for
Okay.
10 more questions. Like that, they can analyze their examination.
But take that risk only when the
When
student
they know that, yes, ma'am, definitely.
related to it.
Yes.
Okay. It's not and also we know the importance of this exam. We cannot go for that much risk, like हवा में मतलब तीर नहीं मार सकते.
मार सकते, और जब भी कोई हवा में तीर मारता है वो तीर लगता ही नहीं है, वो हमेशा वही हो जाता
there is 90%
है.
chances that it will be
Be
wrong.
wrong.
Okay, definitely, sir. Thank you for the suggestion. Okay, so ma'am, in the end, would you like to suggest a very important subject that students should keep the focus on that subject from the very beginning of this preparation?
For this preparation, I will say every subject they have to see from the beginning on. Because
Okay.
for MCQ, revision is must. At
Okay.
least 5 to 6 revision of each subject is required if you make that MCQ correct at the end of the examination. So, regarding subject, each and everything, whatever subject we have discussed, each and everything is important. Like every subject is important. Only they have to focus is the area of question, right? That they what they can do, that they can focus the area of question. And if I talk about pathology, right? If someone is like they are not willing to study pathology, what they can do is that they can study general, at least study general pathology from there. From pathology, study general pathology, because general pathology is the area from every time question used to come. And rest part of the pathology, if they are not studying from pathology, it will okay, because maximum things they can cover in medicine only. But
Mm,
rest, say for rest subject, they require preparation from the start only, because they need revision.
mm. Yes, ma'am. Okay, ma'am. Thank you. And any message or final tip you would like to give to the 2025 aspirants from both of you?
Yes, ma'am, definitely. Yes, to all the students who are going to appear this year, and for our students also, those who are under our coaching banner, for them also, I would like to wish all the best. Stay calm. Don't worry. You have worked hard for the so many, like you are giving your time, right? You are working hard. Just have faith, work hard, you will get the success. So all the best to them. That's it. Thank
Same, ma'am, from my side also. Best wishes to all the aspirants, to all the students who have been working hard for the last 1 year, or there are students who have already been attempting previously but they could not crack. They are again sitting. Uh, Much more wishes to them so that they
you. We will
go
crack
out
this time.
and
Yes.
come with flying colors, getting colleges of their wishes. That's it, ma'am.
Because the fear of not cracking, only I guess, only those who will understand who are already in that situation, right? What
Yes,
is the
yes,
fear that if I will not crack, I have given so much of time, I'm investing my time, I'm investing everything. So that fear I cannot explain also. What is the fear of not cracking the exam? So just
yes.
I wish to everyone who is preparing, I know there are limited seats for the government college, right?
Hmm.
Not everyone can get to that government college, but still those who are giving their more hard work, best wishes for them.
Yes, ma'am. And in the end, I would also like to say that studying, yeah, with your passion and your dedication, it's never a wasting of time. Either
Exactly.
one get not selected, but your knowledge will be very helpful
Definitely.
for the lifetime. It will be very.
Definitely, ma'am. And what I will say, this preparation is just like, if I'll use the word like addiction, I can say, right?
Mm,
If someone is not clearing, I know they will have knowledge, they will have everything. But if
mm,
someone is not cracking the this entrance in
mm,
one go, what happens that inside them something like everything get builds up. If not this time, nahi, मुझे अब next year तो crack करना है. So
mm.
they will sit for the next time also.
Yes, ma'am. They will definitely get motivated when
Exactly.
we see the level of our preparation, and then we see that from this type of preparation they can get these marks. Then only student get motivated that if I study more harder, then my
Yes.
will increase.
And
So we all know the ma'am, this exam required lot of hard work,
yes, ma'am.
and we totally understood, the mental state of the student while preparing for this exam. Sometimes we get motivation, and also we sometimes get demotivated. So ma'am, very last question from both of you again. Ma'am, if at any point of your preparation, do you ever feel demotivated?
Yes, ma'am. Definitely. Right. We are everyone like those who have already prepared or those who are preparing. When you don't do anything, especially to those students, like we are from West Bengal University. Out there, what happens that we used to be eligible only after our internship only.
Mm,
Because our internship used to like it used to get finished in that time period where we are not eligible on that, like on that year. So for
yes.
us it's like that we have to appear next year. So you are doing nothing and you are just sitting, right? You are just sitting and you are just studying. And this is like this is the time when you feel like demotivated, like whether I will crack or not, like
Mm,
what I'm doing nothing, I'm just studying because you have completed your BHMS. Already it is completed. And right now I don't have anything. I don't have anything to, like, I'm not doing any job also. I'm just sitting and I'm just studying. This is
mm.
the time we used to feel demotivated. What I feel like that.
Yes, ma'am. So it's very difficult to, get up and try to stay positive while the preparation.
Definitely, ma'am. And plus, if such kind of situation is happening to any student, I will just say, just think that in coming days you are going to get one a very reputed degree, right?
Yes,
So
currently.
that should be in your mind. That makes you motivated all the time, right?
Mm,
That is the most important point I will say, because it was your decision to do MD. It was your will, it was your wish that
yes.
yes, you will do MD. So that will keep you motivating during your whole time during the your course of study, right? And another thing, just I will say, stipend is also another factor, right? That will keep you like, yes, I will do it, because we know that in coming 3 years for 36 months, I will get a fixed stipend and a
Yes.
handsome stipend, I will say right now.
Yes,
That
ma'am.
is also
But it is a very, good source of motivation, I would say, because
yes, definitely.
during the preparation time, students think like, I'm not doing any job, I'm not doing any clinic, we are not earning at all, and other students are earning. But when you see your stipend you are going to have, plus others, that we I do not comment on anyone's, but when we compare ourselves, we get that motivation that we are
Exactly.
going to have such a great future after cracking. Like,
Yes,
so I think that also a source of motivation. So, ma'am, it's time to wrap up, and I would like to thank both of you for your precious time. And I hope many participants get the golden advice from both of you. Thank you so much, ma'am, on coming Homeopathy 360 and sharing your clinical and plus your experience and your tips and tricks to crack AFPGT.
thank you, man. Thank you so
Thank you
much.
so much. Thank you so much, ma'am. And we once again wish all the aspirants a very
Best,
best,
give
and
your best on
they do
4th July.
the
Yeah.
best on 4th of July this year. Thank you.
Thank you so much. Thank you, everyone.
Thank you, ma'am.